Hi all. This is Michelle, and I'm going to have our Q3 staff meeting. Today is October 31st, so happy Halloween. Sorry, I didn't get the memo. I forgot. Actually, when your kids grow up, you forget about Halloween. But one of the first things I'd like to do is introduce to you our new Director of Nursing, Marcy Wern. Come on over. Marcy didn't forget about Halloween. Hi. This is Marcy.
I'm representing.
She didn't forget about it, or she got the memo. But Marcy is going to be the new acting DON. I am going part-time, going to take a little bit more time off. I will still be very involved with the business, but I won't be in the office every day. So that's where Marcy is taking over, being in charge clinically of all nurses, and she's there for help and support. She'll be doing supervisory visits as well, doing annual reviews. So she will be the first line manager after your branch manager. So I just wanted to introduce, and I'm super excited. She's got over 25 years experience, and she used to teach CNA courses. She's worked in assisted living, home health care. I will attach her bio when I send out the meeting minutes and all the attachments of today's meeting, so that you can see what her history is. So we're excited to have her and look for her. She'll be in and out of both offices periodically. So thanks, Marcy.
Thank you. I'm so glad to be here. I can't wait to meet everybody in person. So
okay,
I'm going to turn it back to Michelle to do our meeting.
Thanks. Okay, so I'm going to start doing my screen share. And as you recall, when I do these meetings, I do I embed 3 words into my discussion. I hide 3 words that I'll announce, and you have to get those 3 words and send me an email so that I know that you listened to the meeting, and then you get paid for attending the meeting. Okay, so we'll start the meeting, and then I'll give you the word. So this is the agenda for the staff meeting. Let me find my little thing here. So what I always start discussing is our customer satisfaction and employee satisfaction scores. We get these results from the satisfaction survey that you get a phone call. So our current customer satisfaction is 73%, employee satisfaction is 89%. Both those numbers are good in the industry. Employee is usually in the 60s. Customer is actually 71, 68 to 71. So we're still a little above that, but we'd like to see that get a little bit higher. But we're really excited about the employee satisfaction score that we got this quarter. So thank you for that. And always let us know if you identify areas of improvement where we could do a better job. The next thing on the agenda is the Joint Commission 2020 National Patient Safety Goals. There will be an attachment in your, when I send out the email with the link to watch this meeting. These are the National Patient Safety Goals for next year. So they haven't really changed much, but I just wanted to review them so you're aware. The first one is always make sure that you identify patients correctly, and we do that by using 2 patient identifiers every time you see a patient for the very first time. It's a policy with BrightStar that you ask for name and date of birth before you do anything for that client. So that hasn't changed. Use medication safely, so recording and reviewing all medication lists. This is for nurses to review with the clients and make sure that the client understands what they're taking and why, and letting the doctor know if there's any concerns. Preventing infection has to do with hand hygiene. This is why we do periodic supervisory visits on our caregivers and nurses and therapists to review their technique and make sure they're doing good hand hygiene at the appropriate time and wearing gloves. Prevent patients from falling is the next one. And that's just identifying patients who are at risk. Is there a chance that their medication might make them weak, dizzy, or sleepy? And if so, is there any action that we can take to prevent our patients from falling? And the last one is identifying safety risks, especially for clients who are on oxygen. So when we do chart reviews, we're going to be looking to make sure that nurses have documented on people that are on oxygen, that they are indeed educated on the risks of oxygen in the home, the safety requirements, and they're aware of, no open flames and such in the home. So that's the National Patient Safety Goals for next year. Just a reminder, especially for nurses, that we do have a policy that I will also attach that tells you the approved and unapproved abbreviations. Doing chart reviews, I saw this abbreviation, ATB, which I think was for antibiotic, and this one, which I'm thinking meant reaction, but it's a guess, and it is not, neither of these are an approved abbreviation, so please follow our policy on approved abbreviations, which will be attached. Some exciting news, the skilled platform that BrightStar was working on isn't quite ready yet. They're still working on it, and I'm not sure when it's going to be ready for us to use, but until that time, we are currently working on a platform called IGEA that our nurses and therapists will use to do electronic documentation. It's going to be simple and easy to use, and we will be using that until BrightStar's skilled platform is ready to go. So I'm anticipating maybe about a year that we'll be using IGEA. We're just now at the stage of entering all our customer data into IGEA, and once we've completed that, then we'll begin having nurses and therapists come in, and we will train you on how to use the system, but it's pretty simple, and it gets at the notes to us immediately, and it has good quality assurance reports where we can make sure that all the T's are crossed and I's are dotted and signatures are on the forms. If not, we send it back to the clinician to say, please sign this or finish this section, and then you send it back, and then we move forward. So we're excited about that, and we'll let you know when the trainings are. I'll go ahead and give you the first word, the hidden word that you'll need to respond in your email to me, and that word is Halloween, since it is Halloween. The next thing on the agenda, excuse me, is for nurses to make sure, I'd like you to document when you first get to the home, document the condition of the dressing. In other words, is it dirty or removed, or is it intact, clean and dry? I think this is really important so that we can identify if the client is removing the dressing or doing anything to the wound when we're not present, or are they walking on it without a cover and it's filthy, or what? I don't want the client to be messing with the dressing and then the wound becomes infected and they're saying, your nurse did something, when if we clearly document, that the client's been taking off our dressing or doing unapproved wound care and hasn't been instructed or something to that effect, if that's documented clearly, then it would cover us. Nothing has happened, but I just think it's important that we do that. The next one, also related to wound care, is on your cover dressing, if you're doing a wound vac or just a simple dressing, no matter what, on the exterior dressing, I would like you to document what you placed in the wound, if it was an ointment or a gel or a gauze or iodoform packing or a strip or foam, two black foam, one white foam, or approximately 5 inches of packing strip or Aquacel rope or whatever's in there, one section of rope, then the date and your initials. And this is so that I've talked about this before, but we have several clients that go to the doctor's office and get wound care, or go to a wound care clinic and get wound care, and we have no idea what they put in the wound. I'm hoping that if they see us writing on the exterior dressing what's in the wound, that they will follow suit and say, oh, well, let me go ahead and write what I put in the wound, so that we know what to take out the next time we do wound care. If they don't document what's on the wound and the nurse goes out there the next visit and has no idea what she has to be removing, then the nurse needs to call that doctor's office or wound care clinic and ask what they placed in the wound. So I'm hoping if we start this trend that they will follow suit. I'd also like you to take a picture of the wound dressing covered once a week so that we can try to determine if they're removing it, and then do your measurements once a week. That's nothing new, it's just a reminder. Also want to remind you that when you are getting ready, nurses or therapists, to recertify someone for another 60 days worth of services, that right before you do that 485 or that recertification, that rather than using your regular visit note, you must use a reassessment form. It's required that a recertification is done every 60 days as well as a reassessment every 60 days. So just instead of using your regular visit note, you're going to use this form, and I have a copy of it to show you right here. So this is the reassessment form. You can use it as your regular nurse's note. You can put vital signs up here. Oops, I didn't mean to do that. Take that off. In this section, you can do your review of systems. It's got everything you need. You can document your wound care over here. You can discuss any changes to the plan of care and sign at the bottom. But at the top, when you're getting ready to do it, just circle that this is a reassessment. That is required every 60 days. So just a reminder on that. I'll give you your second word. Your second word is healthy. Like, if you don't eat all the candy that you get trick-or-treating, you'll be healthy. And then, let's see, the next item on the agenda is making sure that goals are measurable. This is relating to the 485. It's a requirement that goals should be measurable. And I have an example of one here. So the goal, this is for a med setup that we do on a patient. The goal is that the client will receive accurate med setup every 2 weeks per orders of the PCP throughout the certification period. That's what made it measurable. Or if I said, you know, client will take all meds as prescribed within 2 weeks, because then we're going to discharge them. You just always have to have a time frame to make it a measurable goal. Wound care will, wound will be healed or close to, progress close to healing by the end of the cert period, or within 3 to 6 weeks, or whatever it is you want, but it has to be measurable. Rehab potential is related to the prognosis, how well we think that they're going to be able to meet that goal. In this case, for this client, it's fair because her dementia is worsening very quickly. And the discharge plan should be, you know, what are our plans to discharge this patient? Maybe there's none. Maybe it's when the wound heals. Maybe it's when the client asks us to. In this case, this is a private duty client who has an aide and gets a med set up. So we're not going to discharge her until either the family requests it or the physician orders it. So that has to do with the goals. Also, a reminder for nurses that your nurses' notes must match the frequency on your doctor's order. So if the doctor's order says, you know, see this person twice a week, we have to have 2 visits every week or a missed visit if you're only doing 1 visit. So we have to have them match consistently. When I did chart reviews, 66% of chart reviews, like 1 week the nurse would see someone once and I didn't always have a missed visit report explaining why. So that's just not acceptable. We have to have an explanation if we're not following the frequency of the visits. That's what these numbers are, by the way, here. Only 18% of the charts I reviewed had measurable goals. Only 33% had reassessment forms. The next thing on the agenda is that we do not clean hearing aids. If you think about it, our caregivers on your plan of care, it should never say, you know, you can assist someone and get their hearing aids in, and some of our clients want us to open up the battery compartment so that it's not using the battery at nighttime. That's okay, but I've had twice now a client that says, we want you to take this little tool and pick up the hearing aid and start cleaning in this little hole. No, the hearing aids are extremely expensive, and unless you have a hearing aid and you're familiar with all the different brands and styles, we could easily break one, drop it, and they're thousands of dollars. And it's not something that, if it were something that we did frequently on a regular basis and we could train you on it, that might be different. But like I said, there's different brands, different styles, and I'm not willing to take that chance of us being responsible for breaking something that is so crucial. These people really need hearing aids, and if it's broken, it has to be replaced, you know, very quickly. They're very expensive. I just don't want that responsibility. So we won't clean hearing aids. We'll just assist people in locating them, and, you know, if they need help getting it in their ear. Number 13 on the agenda is the flu season. It is upon us. I know that people have mixed feelings about getting the flu shot. I have gone, you know, different years without getting one, and other years I get one. I got one this year, had no side effects, everything was fine. I had a little sore on my arm for, you know, half a day, but otherwise it was no big deal. I just wanted to share information with you that went away. Oh, where'd it go? Oh, here it is. So I have some information from the Arizona, let me find it. Here, let me move this over. Here it is, Arizona Department of Health on influenza. So we're just now getting to the peak season. It's just now starting. This is last year to this year. So it peaks, like you see, December, January, February, March. Oops. And this is from the Center for Disease Control. This shows you as well the weeks that it peaks. So we're just now we are currently in week 44, about to enter, we're just now in 45 actually. So this is when it starts to peak, and it goes all the way until, this was 2018 to 19, but the months are the same. So this is March, April, so you can see January, February, March is when the peak flu season hits, so you still have time if you want to get a flu shot. I understand some of you absolutely don't want to. I'm not going to force it on you. I think it's a great idea because our clients are at risk because they're frail and elderly generally, or if they're not frail and elderly, they're ill and more susceptible to infection. So if you do get a flu shot, remember that if you give us proof of getting that flu shot, even if it was free for you to get the shot, which it often is, we will give you a $10 rebate once we get proof of the flu shot. If you do not get the flu shot, we ask that you wear a mask when you go into a BrightStar client home to help reduce the risk of getting the flu. So it is important, and we will, when we do supervisory visits, if you haven't had a flu shot, we'll look to see that you have masks. The masks are available in the office, so if you're not going to get the flu shot, please get some masks. The next thing on the agenda is Google Translate. I was actually looking at possibly a service where we would provide a translator. It started getting really complicated and really expensive, and someone, actually Marcy, our new DON, told me about Google Translate. And we both have learned something about it. It's a really cool app that, let me show you here what it looks like. This is what the app looks like. It's free to download, and it works for Android or iPhones, iOS products. But this G here is what it looks like. It's super easy to use. And then I'm going to send you, when I send you the information in the email, I'm going to send you a link to this YouTube video that will show you how to use it, how cool it is. You can actually, if there's a sign in someone's home in their language, you can actually point your phone, turn on your camera when you're in this app, and it'll read the sign and superimpose the sign in the language that you want. So in other words, if you were driving in another country and there was a sign and you didn't know what it said, you would turn on the app, turn on your camera in the app, point it at the sign, and it would say, no right turn, or something like that, and it reads it to you in English. So very cool, free app. I recommend that you get it, and then I will send you the link to this YouTube video. It's only a 9-minute video, and it explains how to use it. So that's how we're going to deal with translations. In 12 years, I've only had one nurse who needed a translator. So it's not something that I want to pay monthly translation company fees for when we really don't need it that often. And I think this app is a great alternative to solve that, so that if anyone does need a translator, it's right at your fingertips. Reminder for nurses that if you're getting orders over the phone from a physician or a nurse practitioner, that you have to write the word TORB, which means telephone order readback, by your signature, and this tells us that you verified that order with the practitioner. So if they said DC wound vac, do wet to dry twice a week with normal saline, that you clarified with the practitioner before you hung up, saying, okay, so I heard you say we're going to discontinue the negative pressure therapy and we're going to go to wet to dry using saline twice a week with gauze cover with an ABD. And they say yes, and now you've done your telephone order readback. This is for nurses or therapists who might be getting orders from the clinician. Reminder to always call us about a change in condition, a fall, or hospitalization. Oh, we do have a new policy. When we answer the phone, we're going to say this is a recorded line, so just so that you're all aware. Our calls into or going out of the office are recorded, so I'm just letting you know that. The next thing on the agenda is the Employee of the Month for third quarter. So in Sierra Vista, this is July, August, and September, it was Monica, and then Yvonne, and then Natalie. And then for Tucson, it was Monique, Laura, and then Veronica. So congratulations to all of you. Thank you for what you did for us and being our Employee of the Month. They received a $50 bonus and an opportunity to go to breakfast or lunch with the branch manager. So thank you guys for all you do for that quarter. We appreciate it. Also, congratulations to our caregivers who received the Q3 core value bonus. Your names are there. It's Patty, Linda, Hope, Queen Anne, Karen, Barbara, James, Karen, Elissa, Marissa, Shantae, Lily, Delane, Nunzia, Claudia, Laura. And your name could be here also. So thank you for that. They also are receiving a $50 bonus in their check that you should get tomorrow. We appreciate you following our core values. They're very important to us, and thank you for that. We have, Alan and I went to our annual conference, and it was in Wisconsin in the winter. That was great. And we did, there are some changes that are coming that we're excited about. I won't roll them out yet because they haven't happened yet, but one of them has to do with a mentorship program that I'm really excited about. And as we get more details, we'll be sharing more with you. Let me make sure I don't have any other attachments that I wanted to share. I'm going to send you this in your email that will have the Google Translate information. Oh, and then I did want to share this Joint Commission. It's a cute little video on preventing falls. So let me go ahead and start that now and see if that, yeah, that should work. So it's a cute little video that I'd like you to watch. It's not even 2 minutes. So here you go.
Injuries from falling can lead to serious physical problems, but there are easy things you can do to help prevent slipping and falling.
How's your wrist doing? A bit better. I'm going to my optometrist today. I think I need new glasses. Oh, look out! Whoa. Yeah. New glasses will probably help.
Improve your balance by exercising and drinking water to prevent dehydration. And have your vision checked. By installing night lights in commonly used areas and non-slip treads on the stairs, you can make your home safer.
I think at about 1 a.m., these are going to come in handy. Well, that and Grandma.
Oh, we are going to have some fun tonight. Here comes Grammy. I'm clocking in. Always use handrails. Wear shoes that have non-slip soles with backs on them. And look, I found Baba. And avoid clutter to make sure pathways are clear. If you are staying in a hospital or nursing home or are getting physical therapy, ask for help. You may be weaker than you realize. Tell your doctor or nurse if medication makes you drowsy or unbalanced. Injuries from a serious fall can affect your health for the rest of your life, so be sure to speak up to prevent falls.
Oh, isn't that cute? I just wanted to share that with you guys. And let's make sure that there is nothing else on the agenda. No. So thank you. That is it. Let me go ahead and stop sharing. So thank you guys for attending the meeting. That's it. Remember to send me the email with the 3 words. I know I didn't give you the 3rd word yet. It is cavities, because you will avoid those if you don't eat all the candy trick-or-treating tonight. So if you are taking your little ones out trick-or-treating tonight, have a great time and be safe and dress warm, because it's kind of cool as soon as that sun goes down. Appreciate all you do for us. Like I said, I'm going to be working part-time, but still very available by email, by phone. I'll probably do a lot of work from home and periodically still come into the office, but really excited about Marcy. She's very talented, very enthusiastic, and has really great ideas. So I think the combination of Lisa and Christina and Marcy is so far working really, really well. So really excited about that. Please support Marcy and welcome her to our family and our team. And I thank you for attending this meeting. Have a great day. I'm going to go ahead and sign out now.